Welcome. Today we're going to be talking about the arterial blood gas, the ABG. And we're going to talk about the norms first, but it's also very important to know what happens when it's not normal. So what does the body try to do to maintain homeostasis? What is your patient going to look like? But let's start out first with just talking about the normals. So a normal pH should be between 7.35 and 7.45. In an ABG, you're given the PO2, the partial pressure of oxygen, which should be between 80 and 100. Now that's not to be confused with the oxygen saturation, which should be like 95% to 100%. So that's different, the partial pressure of oxygen. You're given the bicarb, which is HCO3 negative. It should be between 22 and 28. And you're given the partial pressure of carbon dioxide, the PCO2, which should be between 45 and 35. Wait, did I say that backwards? No, I didn't. And here's why. I'm going to teach you a really good way to remember this. So your pH, think of it on a balance beam, on scales, or on a teeter-totter. It should be between 7.35 and 7.45 in order to maintain balance. Now, if the pH is less than 7.35, it tips to the left, and you have acidosis. If the pH is greater than 7.45, it tips to the right, and you have alkalosis. So you can tell if you have alkalosis or acidosis by looking at the pH. Now, is it respiratory or metabolic? Well, that depends. Let's first talk about bicarb. Bicarb is controlled by the kidneys, and so it causes metabolic acidosis or alkalosis. So if your bicarb is less than 22, it tips the scales to the left, and that's acidosis. And because it's the bicarb that's doing it, well, now you have a metabolic acidosis. Now, if bicarb is greater than 28, it tips the scales to the right, and you have an alkalosis. Because bicarb is causing it, you have a metabolic alkalosis. Now let's talk about partial pressure of carbon dioxide. Carbon dioxide is controlled by the lungs, and so it's a respiratory issue. So a carbon dioxide that is higher than 45, this is why I said it this way, higher than 45 is going to tip the scales to the left, and you have a respiratory acidosis. But a partial pressure of carbon dioxide that is less than 35 is going to tip the scales to the right, and you have a respiratory alkalosis. So let's see. You have the content knowledge now. Let's put it to a passing level NCLEX style question. Now this requires critical thinking skills, and it's those really firm, solid critical thinking skills that you need to be able to pass the NCLEX. And that's what Kaplan is going to help you with. But let's try it out. A client was admitted with a diagnosis of myasthenia gravis and acute respiratory acidosis. The most recent ABG shows a pH of 7.36. So not quite acidosis. It's balanced. A little bit on the left side of the scales, but it's balanced. It's within normal limits. Notice the PCO2 is 47. So the partial pressure of carbon dioxide is still a little bit high. The bicarb is 24, which is fine. The PO2 is 108. Which of the following is a priority? Okay, let's think about these. Increase the oxygen to 4 liters via nasal cannula. Well, that would increase oxygenation, but we already know that our patient is hyperoxygenated. Their PO2 is 108. So we can eliminate number 1. Document the findings. Well, this still is not normal because the PCO2 is still high. So I can't document it yet. I need to do something to try to get that PCO2 down, so I can eliminate that one. Assess the fingers and toes for a tingling sensation. Well, that's not appropriate for this one. We'll talk about that in a future video, but that's not appropriate at this point in time. What is appropriate for our client is to encourage incentive spirometer 5 times every hour. Why? Because it's going to increase the alveolar surface. That incentive spirometer helps to open up those alveoli, so it increases the surface area for gas exchange. And so we can get rid of that excess carbon dioxide, and that's exactly what we need at this point. So hopefully you got the point. Stick around. We've got a few other videos. Come back and watch those about what happens when the ABG is abnormal. What does the body do about it? What causes it?